patience is a virtue.
Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, don't forget about caring and sharing. Talking about sharing those med moments. And you remember what a med moment is? That time when you have that pain in your ankle or chest pain, and that little pain triggers that moment in time when you know you have to go see your doctor. That's a med moment. Well, we have a website, obeyyourdoctor.com. Email me. Go on the website, check it out. There's all kinds of educational stuff on there. And guess what? You can email me and tell me your med moments so that we can read those and understand what's going on out there so we can gear the show to something that's meaningful for you. Well, we have a great topic tonight. It's a great topic. It's cataracts. And I have the perfect person to talk about cataracts. His name is Dr. Robert Cunningham Jr. He's partners with Dr. Robert Cunningham Sr. And Dr. Cunningham is going to cover this topic from A to Z, from top to bottom. We're going to do it all. So, Dr. Cunningham, welcome to our show.
Thank you.
All righty. So glad that you could take the time out from your busy practice to come and talk about this very, very important topic. Well, as far as cataracts, let me ask this question. What is cataracts?
Good question, Dr. Obey. Omar.
Yes.
It is a condition in the eye, a very, very common condition, where the lens in our eye becomes cloudy or blurry, opaque, and people have difficulty seeing, reading the Bible, watching television. It's a very, very common condition, which luckily can be helped.
Excellent. Now, I just want to step back for a minute. When we're talking about blurry vision, we're talking about the sight. If I'm looking at something, that reflection going back to the back of the eye, it won't get there.
Right. When the cataract develops, as the cataract develops, the light from the outside can't get through to the back of the eye called the retina.
Okay.
And that's usually from the cataract that's blocking it.
Okay.
Our job is to first find it and take care of it by often removing the cataract.
Okay. I want to step back again. Where is the cataract? Is it we have different components. Do this for me. Sure. Describe the eye for me so we have an understanding. I know that the dark part in the center is you tell me what the eye is all about.
The eye is a very interesting organ. It's similar to a camera. The outside of the eye is the cornea that where the contact lens will sit. It's very clear, like the windshield of a car. You can see into the car, but there's a piece of covering there. Further deep inside, the brown part is called the iris, or blue eye is an iris. The circle in the middle is a hole, physical hole, and behind that is our lens. Like the lens in a camera, the eye has a lens. Right. That lens, if it becomes opaque or cloudy, turns into the word cataract.
So the actual lens, I even had it wrong. The lens actually is the part that gets the cataract in it.
Exactly.
Oh, all right.
Behind the cataract is a big cavity full of fluid and blood vessels, and the back layer of the eye is the retina, which is almost like brain tissue. It's really the brain of the eye. Very, very sensitive, very, very fragile.
Right. What causes cataracts? What's the cause of it?
Most often the cause is simply aging. All of us age in some way or another, either gray hair or bald hair.
I know that.
we know that. And the eye too ages over time. Right. It's very slow, but it does happen, one eye or both eyes. Right. And luckily there are ways to help that, either glasses or other ways.
Will everybody get cataracts if they live long enough?
Essentially, yes. The lens of the eye becomes older, just like all of us get a little older in our skin, in our brain. The eye does become a cataract. Although we can find it in children, there is such thing as a congenital cataract. Rare, but it does happen.
So the thing of it is that it's most common in seniors then.
Correct.
And that's the people that usually will. Tell me this: how would someone present to your office that would come in with cataract? What are some of the things that they may say to you that you may clue you in that this patient may just have a cataract?
It's a very common occurrence. Every day, people come in needing what they think is glasses or blurred vision. They can't read their Bible. They can't watch television. A very common one is I can't drive at night.
Right.
Distance driving becomes a problem. Right. Everyone has some problem throughout the day, but when it becomes very, very difficult, they'll come to see us. Oh. So it's the blurred vision. It's the inability to read or even see the computer now with a lot of computer use. People have difficulty seeing. Right. And we put drops in the eye, we examine the eye, we dilate the pupil, and find out if it is the cataract.
Is this a problem that can be solved by glasses, wearing glasses?
Often it can. Often it can. We can increase the strength of your glasses, make them stronger or weaker, make them appropriate. Often it does come down to where you have to have the cataract removed.
Okay, all right. Is there ever a time when it gets better on its own?
Cataracts, no, will not get better on their own. You may tolerate it. You may allow your vision to be not as sharp as you want it to be, but they will not get better.
Okay, all right. And what about things like blindness? Is it possible with cataracts?
Blindness is a condition that is relative. Some people think they're blind if they can't see their television or read their book. Usually people will seek help now with better care here in this country and throughout the world, and get attention to their cataracts. So blindness is rare, but it can happen. It does happen throughout the world, and it can be helped.
Right. I want to step back just for a second. We're going to rip up the script here for a second.
Okay, good.
I want you to tell me, just give me an understanding of the eye and sight. Like, how does vision come into the eye? Where does it go? I know that it goes to the nerves, and then it does some fancy stuff around this thing called the chiasm, and then it goes, what part of the brain? Tell us, give me an idea of what vision, how we see this marvelous thing of vision.
Yeah, the vision is a wonderful tool, so to speak. We have a sensory nerve. The eye can be thought of as a nerve. God gave us two nerves. Light will come through the cornea and through the pupils.
Right, that's the front of the eye.
Front part of the eye. Comes through the front. It goes through the lens, goes through the lens in the eye, into the back of the eye, and then the light itself is transmitted to the optic nerve, the nerve that connects the eye to the brain.
Oh, all right.
Once it gets to the brain, a certain part of the brain, the light then is, the image that you're looking at is reversed, inverted, turned back upside down.
Oh, really?
So that the person sees the object in the correct orientation. So when light comes
Say
in,
that again.
When light comes in,
you're looking at it. The only reason it's standing up is that it flipped over.
That's correct. That's correct.
Interesting.
When light comes through the eye, within the eye it actually is upside down.
Right.
When it gets back through the optic nerve to the brain will reverse it and turn it up, right side up, so that what we see is in the correct position.
Interesting.
It's very, very interesting. There's two eyes have to coordinate. We can't be out of sync, otherwise we'll have double vision. And it's a very interesting organ and very delicate.
Right. What part of the brain controls sight?
Behind the retina, through the optic nerve, back through the posterior, after the chiasm, it becomes the posterior part of the brain.
All right.
Is really the control
center.
Like the
occipital, or is it it's called the occipital?
There are many lobes throughout the eye.
Okay.
And the occipital lobe is the main controlling center for vision, although there are some other areas, like, as you mentioned, the chiasm,
right, that kind
where
of
the
stuff,
nerves
those
change.
Nerves going through. But that part of the brain that actually allows us to see is in the back. And
is the posterior part of the, that's right, is in the posterior part of the brain.
Right.
both sides of the brain, called the occipital lobe, not the frontal lobe, the medial lobe, but the occipital lobe. And that is really with the power of the brain for vision.
Right. So if someone's to have a stroke and they lose vision, it's a good chance that the occipital part of the brain affected their vision.
Very good chance of that.
Right.
Or along the optic nerve.
Somewhere along
the highway, the root is affected by blood vessels and things that go on in the brain.
Right. Let's talk about some of the things that may, like secondary things. Secondary is a big word, but things that may cause cataracts. Yeah. Things like, go ahead.
Medications can do it.
Okay.
People are on steroids. That's a very common problem.
Yeah.
Antibiotics at some point can cause secondary cataracts.
Okay.
One of the bigger causes is injury or trauma. We fall, we get hit, a motor vehicle accident. Cataracts can be caused by trauma, very much so. Also, medical conditions, as in diabetics or lupus, very common cause of making the cataract get bigger more quickly.
Okay, all right. And when it's secondary to another disease, is it a different type of cataract, or is it all the same thing?
The cataract is a lens, and the lens, like the shape of an egg, is cylindrical.
Right.
And there are different layers within the cataract, the outside shell or the inside, the nucleus. Sometimes there are different parts that can get affected by different types of medications.
Okay.
Essentially, it all is the same, but it starts at different layers.
Okay. All right then. Now, you kind of touched on this initially. Congenital. And just explain, congenital is when we're born, and when something's happening, or prior to us being born. It can be even in pregnancy.
That's right.
When the female's carrying the child, and the child has something happen to it during that time, and this can happen as well. I know that I had read something that if the mother is malnourished, if she's not taking in the appropriate amount of nourishment, it can cause things like cataracts. Tell us about that.
The cataract can come in utero while the child is within the mom, from really the mother's condition, her diabetes, her malnutrition, as you mentioned. Unfortunately, drug use can precipitate changes within the eye, particularly the lens. Different parts of the eye can be affected as well, but cataracts can come from a condition in the eye that the mother is having problems with.
Right. So it's very important for females that are pregnant to understand that what they do, what they eat, how they, if they're taking drugs or something like that, it's affecting the baby.
Absolutely. Must take care of your child.
Okay.
Yourself.
All right then. What about as far as symptoms, like some of the things that I was looking over, and blurred vision or double vision and stuff like that? How often does that happen? Is it something that, you know what I mean? If I get double vision, should I be running to you and say, "Oh, cataract"?
Well, no. There are a lot of different ways that we can people will show up with eye problems, and cataracts are just one of many.
Okay.
Usually, often it's glasses. They need glasses to solve their vision.
Right.
Double vision often is not a symptom of cataracts.
Okay.
Pain, by the way, is not a symptom of cataracts.
Oh, really?
Right.
There's no pain with it usually.
Usually there's no pain. It's blurred vision, inability to read or see distance. Redness or mucus is not a symptom of cataract. That's more of an infection.
Right.
So there are a lot of ways that people show up to the office, and the cataract itself is not always the main cause of poor vision.
Okay. What about tearing and stuff like that?
Tearing as well. That's a good common condition. Now, that is often not a condition of a cataract. Okay. Can be something else that needs attention.
Right.
That we often can take care of, but is usually not a symptom of the cataract itself.
Right. Tell me about as far as genetics. If mom had it, dad didn't have it, or dad had it too, am I likely to get cataracts as well? That's
a good question. There is quite a bit of research now ongoing that is trying to determine if the cataract itself can be a genetic marker. We're not finding strong research evidence that the cataract is a genetic condition. However, if mom or dad or granddad had eye problems, it's best that we seek out our care with the eye care provider. But cataracts are not necessarily genetic in nature.
Right. What about race? Is there a particular race that may be more prone to it than another race?
We have not found that to be true. Everyone ages hopefully gracefully. The aging eye will often sometimes, across all races, develop cataracts or not develop cataracts. So it's not a race-related thing.
Okay, all righty. I know a lot of diseases out there we screen for. You know, I know for lungs, for instance, we may do screening CAT scans for lesions in the lung or masses in the lung. Is this a particular problem that screening would help?
You know, screening for cataracts is almost self-explanatory. People screen themselves.
Okay.
When they can't see, can't read, they're coming to us or someone to find out the reason why. And we always start slowly with the vision chart and the need for glasses and examination. Often it's a cataract, often it's not. So people will almost screen themselves.
Does it usually happen in both eyes? Or can it be just one eye? Or, you know what I mean? You understand what I'm saying.
Usually the cataract does occur in both eyes.
Okay.
One may be more exaggerated than the other, and one may be bigger than the other, or larger than the other. But yes, usually the cataract is in both eyes. It's your same body, so your body's changing the same way, left and right side.
Reason I asked that was because, for instance, if you're a football player and you get hit in the eye, you get trauma to the eye, and this particular eye, and as the years go on, you get a cataract in that eye. There are certain diseases out there that if it happens to one, say sympathetically, just because that's happening on this side, it's going to happen on that side. Does that happen with cataracts?
Not necessarily, no. People who have had trauma develop the problem on that particular side. People that are diabetics, however, may develop them in both eyes. But it is not necessarily sympathetic. Issue. No.
Right. You have a limp, so I'm going to have a limp. You know the deal.
Right.
Okay.
Cataracts don't quite follow that.
They don't follow that. There's something called senile cataracts, and I know that, and we had touched on nutrition there for a minute. Vitamins, certain vitamins lacking in our, is that a big component as far as cataracts are concerned, like vitamin E, vitamin C, essential minerals and stuff like that?
Vitamins themselves have not shown to be a deterrent to cataracts. To the general health of the eye, to the general health of the body, yes, but not to the lens itself, not to the cataract itself. We do encourage all of us to take our vitamin C, take our vitamin E, for other problems throughout the body, to prevent other problems, but not necessarily the cataract. Maybe macular degeneration, which is another topic.
That's a big word. You just flew right over my head, you know that.
Yes. It's a different problem, can be addressed with vitamins long-term, but not the lens, not the cataract itself.
Okay. There's so many things, and we are what we eat. I like this nutrition deal, right? We are what we eat. Patients that, you know, high cholesterol is just such a big issue on other aspects of our body. Is that a problem as far as the cataract is concerned? Is cataract made up of cholesterol or something like that? I'm not sure what it's made
cataracts are the lens of the eye is actually protein, which is amino acids. The cholesterol affects more the retina, the back of the eye, the blood vessels, not the lens itself. However, if your health is not good and you're not able to control your bodily functions, as in your blood pressure and your blood sugar and your cholesterol, then it will affect the its overall eye, but not necessarily the cataract.
Okay. What about things like UV light? There's always different types of lights and stuff like that, and the eye is directly, you know, affected by these.
Exactly. We didn't talk much about the ultraviolet light coming into the eye, but the ultraviolet light plays a big role in the lens, the cataract development.
Okay.
It also plays a part in the retina, where the macula can be involved.
So that's the back, just to
The back layer of
clarify
the eye,
again. Yeah.
back of the eye, the back layer of the eye near the brain, towards the brain. The UV light should be lessened with appropriate glasses, or even the natural eye will have the pupil shrink down to prevent the eye from taking in too much UV light as best it can. If and when we ever get to cataract surgery, the implants that are put in have UV protection.
Oh,
so there are methods to prevent ultraviolet light from getting back into the eye, but we can't prevent everything.
Okay, well, all righty. What about things like smog and stuff like that that the eye directly comes in contact with? Does that affect the lens at all? Does it get to
no,
the lens?
those do not affect the lens. They affect the tearing, the eyelids, the sensation of the eye, the cornea, but it does not affect the lens at all.
All right. I do want to get to, because cataract surgery, and I understand that is a form of treatment. Before we get to that, and we are going to get to that because that's important, are there other types of treatment other than surgery that's appropriate for cataract?
If we have mature cataracts, the best treatment is to be removed.
Okay.
People can wear glasses. They can wait. There's no urgency to have them removed. They're not going to turn to cancer. They're not going to necessarily lose their vision.
Right.
So waiting until you're ready to have something done surgically is not inappropriate.
Okay. Now, you got me here in your
Briefly.
office, right? You got me here. I can't see. you hit me with the big word. You need surgery. Tell me about this surgery, Doc.
Okay. Be glad to. As an ophthalmologist, as an eye care provider, we take pride in taking care of cataracts. It's a very common condition. It's a very efficient way to help people see better.
Right.
Surgery itself is not long. It's not complicated, although any surgery for any person can be unnerving.
Yes.
It is same-day surgery. They come in the morning. They're home within a few hours.
Oh, you serious?
There are no more stitches, no more sutures, no needles, lots of drops. Surgery is done by ultrasound. It's a very calming, reassuring surgical procedure.
Now you know because I'm thinking I got this big needle coming towards my eyeball. You know that, right? That's the way I'm thinking about
those
surgery.
days are over.
Those days are over.
Those days
okay.
are over. Yeah.
Well, go ahead, tell me about it. I didn't mean to break it.
That's okay. The person would come in the day of surgery in the morning, be situated in the room with the nursing staff, an IV in their hand. They're sedated.
Right.
The cataract doctor proceeds with a few small blades, no needles, no injections. The cataract is removed with an ultrasound, like a fine pencil tip. We take out the lens, the old lens, which is the cataract, and replace it with a new clear lens with ultraviolet protection. It sits there forever. It doesn't move, can't be damaged, you cannot feel it. We just take it slowly at a slow pace to get the lens in, close the eye, and that's it, and put the people on drops for about a month.
Are you serious? So I got a bionic eye.
You got a bionic eye, brother.
I love it. UV light protected. I'm cool. I had no idea
We're very fortunate that the cataract surgery has been very efficient, very painless, and people are very rewarded by the result most times.
Right. Now this is very comfortable afterwards. Do you have to close the eye and wear a patch for a while, or?
Most times people only wear the patch overnight, maybe at night for protection from rubbing.
Right.
But no, it's eye drops throughout the day. Check with your eye doctor weekly, every 3 to 4 weeks.
Right.
Then when it's over, when you're healed, within a month or so, we then upgrade the glasses if you need them. Some people don't need glasses.
Right. What about glaucoma? Now, I understand, I was reading something that if you had the cataract repaired or removed, it inhibits glaucoma from developing or something like that.
There have been studies, there are ongoing studies showing that if a person has glaucoma and cataracts, you can have both, that removing the cataract can actually help the person's glaucoma pressure. Doesn't get rid of the glaucoma, but it can help reduce pressure, which is the main cause of glaucoma.
Right.
So therefore, you've had one operation and it's helped two different conditions.
Different things. Okay, all right. Now, if a child has cataracts, do they get surgery? Can they get surgery as well at that young age?
Children are able to have cataract surgery, yes.
Okay.
We're very careful again because this is a lifelong implant.
Right.
We have to be sure that what we measure for the child's implant will last them a lifetime. And these measurements are available and easily done in the doctor's offices.
All right. Is it like, I know people that have had several kidney transplants. If that lens goes bad, can you go back and get a second one maybe 20, 30 years later, or that's not usual?
It's not usual. Usually what implant goes in stays for a lifetime.
Right.
There are rare cases where the implant may have to be adjusted or removed or even cleaned off, so to speak, right in the doctor's office.
Right. So let's just go back through this now. All right, so cataracts are mostly seniors.
Yes.
All right, kind of recap and see where we are here. It's the lens that actually is what gets what has the
Blurred.
problem.
Correct. It's
Right.
the lens. It's not.
And that lens can be taken out and a new artificial one can be put in.
Bionic, as you say.
Bionic, got UV-like protection. I like that. I like that.
It's a wonderful way to help people have a good quality of life without a lot of complications and post-op issues.
Right.
We're very fortunate.
Right. I think this is a wonderful topic. We've covered it well. Dr. Cunningham, thank you so much for coming in.
Well, thank you for having me here, Dr. Bey. Thank you very much.
And I'm going to definitely have you back because I enjoyed it.
Thank you very much.
Definitely. Well, in closing, remember, sharing and caring, obeyyourdoctor.com. Go to the website. Let us know what's going on out there, okay? Never institute any change in your medical care until you consult your doctor. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.
Thank you, brother. You're all right.